my second year as a full-fledged allergy immunology doc, I had just come back from having my second child. I was absolutely exhausted. My body hurt all over. And I went to the dentist for like a routine checkup. And the dental hygienist said, "Hey, Kara, your mouth looks dry. Are you on any medicines that are doing this? Is there anything going on?" And it was that comment that kind of then brought into the picture some other health issues that I had had over the preceding, 5 or 10 years. I ended up being diagnosed with something called Sjogren's disease, which what I know now is actually one of the most common autoimmune conditions.
Welcome to the Don't Feed the Fear podcast, where we dive into the complex world of food allergy anxiety. I'm your host, Dr. Amanda Whitehouse, food allergy anxiety psychologist and food allergy mom. Whether you're dealing with allergies yourself or supporting someone who is, join us for an empathetic and informative journey toward food allergy calm and confidence. What happens when the doctor becomes the patient? Today, Dr. Kara Wada is here to tell us all about that. You may know her as the Immune Confident MD. She's a board-certified allergist, immunologist, and physician who brings a unique perspective to immune system care. Dr. Wada doesn't just treat allergies and autoimmune conditions. She's a food allergy mom, and she lives with Sjogren's disease. That lived experience has shaped how she practices medicine and her unique perspective on lifestyle-centered approaches. In this episode, we talk about Sjogren's, about what it feels like to navigate a fragmented healthcare system, both as a provider and from the patient side, and a lesser-known but well-researched allergy treatment called intra-lymphatic immunotherapy. It's abbreviated ILIT, and you'll hear Dr. Wada call it ILIT throughout the episode. I have heard almost nothing about this other than what she shares on social media, so I was really excited to learn more, and I hope you will be too. Today, I'm so excited to have with us Dr. Kara Wada. Can you please introduce yourself and tell us your background and then how you ended up in this field in such a unique way that you're showing up in it?
Yeah, so I'm so excited to connect, Amanda. I've been so looking forward to this conversation. My journey has evolved, and honestly, I didn't have what I'm doing on my bingo card. Is kind of the short story. Early on, knew I wanted to be in medicine. I looked up to my pediatrician and was just always drawn to a field where I had that human connection and helped people feel better. I also, though, along the way, found my favorite class in undergrad was a course they offered just once. I went to a very small liberal arts school, and it just so happened that they offered an immunology class during a semester that I was there. Then I was able to take part in, and I thought, oh gosh, maybe I'll like this enough where I won't have to go through this whole thing of like applying to med school. Maybe I'll really like the lab work. I loved the science, but I loved the connection to like the case vignettes. Something that was really cool about that course was we not only were learning the science about immune system proteins and cells and how they communicated vital information from across our body, but they also did that in a clinical context, which for an undergrad class is pretty cool. And it wasn't really until, later on though, that I reconnected with that late into my residency. So went through medical school, knowing I wanted to take care of both kids and adults. And so I did residency in both internal medicine and pediatrics. And then about 2.5, 3 years into residency, rediscovered the field of allergy immunology. And within a week of spending time in the pediatric clinic, I was like, oh, we've got it. Like this heaviness that had been on my shoulders of trying to figure out what the heck I was going to do with my life just seemed to lift. And there was this lightness that I was like, oh, this is what I need to do with my life. And so I had to scramble to apply and all of that for fellowship. I thought when I finished my training, I was going to focus on drug allergy. So as I was coming out of training in about 2015, there's a huge push. About 10% of the population believes that they're allergic to penicillin. And what we realized is that label alone increases your risk of actually worse outcomes, worse health outcomes in a few different ways. And if you look at the data of that 10% of people who think they're allergic, only about 1% actually are allergic. So there's a whole lot of people walking around at increased risk of badness because they're not getting penicillin when that's actually what they could get. So that fascinated me. And I was like, okay, this is cool. And then my second year as a full-fledged allergy immunology doc, I had just come back from having my second child. I was absolutely exhausted. My body hurt all over. And I went to the dentist for like a routine checkup, trying to get caught up on self-care, which had kind of been pushed to the back burner as a mom and someone who's working kind of more than full-time hours. And the dental hygienist said, "Hey, Kara, your mouth looks dry. Are you on any medicines that are doing this? Is there anything going on?" And it was that comment that kind of then brought into the picture some other health issues that I had had over the preceding, 5 or 10 years. It was like, oh, okay, I have dry eyes too. I can't wear contacts. And if I wear mascara, I look like a raccoon. I have back stiffness that's really bad and really sore. And that's always better when I'm pregnant. And that's weird because most women, when they're pregnant, have back pain, but mine went away. And so, it's kind of these little breadcrumbs or puzzle pieces that, with the context of my professional background, it finally clicked into place that, oh, I think there might be something autoimmune going on and I need to get that checked out. And so, to make a long story longer, I ended up being diagnosed with something called Sjogren's disease, which what I know now is actually one of the most common autoimmune conditions. It's thought to be rare, but it's just rarely diagnosed. There's a big gap in our understanding of clinical and what is taught. There's a big gap between that and then the reality of the science that's actually out there. So it affects about 1 in 100 women. Profound fatigue, body pain, often has symptoms very similar to fibromyalgia and often maybe diagnosed as fibromyalgia. And then dryness is another kind of key feature that very often is associated, is very common. It's kind of what they call the pathognomonic. So it's like the test question, it's kind of what you associate with it. But for some people, that dryness can come along later in the disease course. Within 2 weeks of that diagnosis, my infant, Josie, she had an anaphylactic reaction to egg. And so it was this rude awakening of like, well, gosh, what the heck is going on? One, we were always in survival mode. I met my husband in med school. So it's, 2-physician household and 2 kids. We don't have family support nearby. So we're kind of relying on our daycare family and trying to do everything on our own because that's what we saw from our parents growing up. We both were super fortunate to have stay-at-home moms. And so I don't think we appreciated how much work our moms contributed to our family growing up. So that set me on this path of learning about lifestyle medicine and getting certified in lifestyle medicine, exploring a bit of functional medicine, in large part trying to create medical care that's what I would have so wanted when I was first diagnosed, or even before I was diagnosed and had symptoms, but didn't really recognize. So gosh, that was a mouthful, but
Well, it's never simple, right? And
yeah,
it's always interesting to me just because of the prevalence of allergic diseases and autoimmune conditions. There are many of you who are like, I'm going to go into allergy. And then obviously end up with some of that on your own plate. It's an interesting path. I wonder what that was like
yeah,
from physician to patient to allergy mom, all so quick.
gosh. I think it was very humbling about 5 to 6 months after my diagnosis. So as a typical type A, I was like, okay, I got this diagnosis. And the thing with Sjogren's is even as of the date that we're recording this, there are currently no FDA approved treatments for Sjogren's disease. Now, reality is that should be changing soon. And maybe even by the time this is published, that may have changed. But at the time I was diagnosed 6 years ago, these things were still very early stage. And so essentially patients would be put on, they would either have watchful waiting and just kind of say, tough it out. Here's some Cymbalta to help with your body pain, like, high five. Or they'd start something called hydroxychloroquine, also known as Plaquenil. It's an old malaria drug that is first line treatment for lupus and a few other autoimmune conditions. And generally, it's pretty well tolerated. Safety profile is not terrible. But it's also not super potent. And it takes a good 3 to 6 months to see it, see some improvement from it. And then there's this huge gap. So one of the issues with Sjogren's that's most worrisome is that 10% of patients will develop lymphoma because in this condition, the B cells, which are part of our immune system, are um, they're a little extra excited. And when B cells get extra excited, they have a tendency to go rogue, and that's essentially lymphoma. And so when things get really bad, they'll use something called rituximab, which wipes out essentially half of your immune system. It wipes out those B cells and antibody production or protein production. That's a big deal. And frankly, in my role as an allergist immunologist, we don't only take care of allergies, we also take care of people with immune deficiencies. And some of those people are born with a low immune system, but also we take care of folks who have low immune systems because of amazing advances we have in modern medicine, but they have some consequences. And sometimes the consequence is that those B cells don't come back. And so sometimes folks who've been on that medicine for some time end up needing antibody infusions or IgG infusions to replace what's missing. So I knew it kind of from that negative context. And I was like, oh, I want to do everything I can to avoid needing that. And so that's where I really tried to double down on lifestyle. Well, that's all fine and good. But if you come to that from a mindset of perfectionism and kind of magical thinking of like, if I get this exactly right, it's going to go away. And you feel some desperation in like, okay, I'm going to try like, there's a superfood supplement that I was getting a lot of marketing through, Facebook and Instagram ads and so forth. And I ended up with pretty significant liver injury from it, liver biopsy, like this whole thing. And so, thankfully I stopped that. My liver got better, but it really, when I was yellow and itchy and fevering without, it was inflammation, turned out not to be an infection. I saw how hard I had to fight for care, and I had every single privilege in the world. I had good insurance. I had a super supportive spouse who is like very medically literate. I'm very medically literate. I have people's cell phone numbers. Like the liver specialist was like, my husband and I kind of helped train him. He was a couple years behind us. So we had a cell phone number. So I could say, hey, Mike, we need to do something. My levels keep going up. And I still like had to really push to get care. And I was like, well, once the dust settled and I felt better, I was like, well, 4-letter word, what does this mean for everyone else? And how can I turn what was not a great situation into, how can I turn those lemons essentially into lemonade, which sounds cheesy, but like you turn your pain into purpose.
Yeah. So much of what you talk about is what I'm drawn to you, but that holistic approach and that functional approach to how the body is working. But then, like you said, we all tend to, as a psychologist, our coping skills can go into overdrive and how detrimental all of those great ways that all those things that got you through medical school, are the things that probably then did not help your immune system to recover once they were too
Yeah.
rich and too draining and all of those things. So it's interesting to hear that from someone on your side of the conversation, and I appreciate you sharing because it's
Yeah.
important to know, but hard to change, right?
No, I think that I think has been one of the most powerful aspects over, the last 5 or 6 years of going on that journey of learning these different, I say like tools in your toolbox of journaling and mindset work and mindfulness practice and self-compassion and just letting go of the guilt that comes along with asking for help or I'm super fortunate that I have the ability to pay for some additional help in some ways. And that has been, I think, the most profound change. One example I would use up until January of this past year, I was on faculty at Ohio State. Through training in the first couple years of my life as an attending physician, I would look ahead at my schedule and I would start to catastrophize like, oh, I'm overbooked. oh gosh, this patient is scheduled here and there's not enough time for this patient. Like this patient should have been in an hour visit, but they're in a 30-minute visit. In particular, I'm not the fastest in my, like to take my time. Maybe not surprising given I'm kind of a talker, but and it would create these worst case scenarios, and I would create so much suffering and stress. Like even that whole night before, sometimes I'd look ahead like on a Friday at Monday, right? And I'd worry all weekend. And then, at least half the time, if not more than half the time, someone would late cancel or, someone who had been on a pretty like rough trajectory and I thought maybe was going to be a more challenging visit because, of whatever was going on, they'd be doing great and things would be awesome. And it was a quick visit. And like what I realized, and I needed someone to help me learn this, right, was that I didn't have to allow myself, like, I didn't have to do that to myself.
Mhm. And it
Yeah.
wasn't happening, right? That's the illusion
No,
that
I was in
preparing
like cortisol, stress, not sleeping well, all these, it's like, oh gosh. And thinking back, like that was kind of my MO, like, gosh, all through life up until I was probably 33.
I'm curious, and maybe there's not data on this, but do you see that approach or that coping
Yeah.
style more often in patients with autoimmune conditions? Is that a contributing factor, would you suspect?
It wouldn't surprise me. My current practice, so when I left Ohio State in January and I opened my practice, the Immune Confident Institute, in late March of this past year, in our practice, I would estimate is probably about 40% of our patients have Sjogren's, in part because it's a very underserved condition and I'm very vocal about it. I also see probably an equal number of patients with mast cell disorders. So allergic flavor of disorders, but it doesn't always play out like typical allergy. And what I suspect happened, I would love your professional kind of thinking on this. In many of these conditions, our body is receiving the signal. So both our small fiber nerves, and which are sensory nerves, and our mast cells, our immune system cells, are receiving information from our environment saying you are not safe, there is danger. That a lot of my patients end up in this state of hypervigilance that totally makes sense. Like if your cells are getting this input of like you are not safe, you may die, avoid, evacuate, get out of this situation, like it only makes sense that then, there would be other aspects of our physiology that just set us up for this, like being fearful of a lot of things. So I see a lot of that. I do see a fair bit of high achieving, quote unquote, type A, not everyone, but a good chunk. Now it'd be really interesting as we're moving to a new electronic medical record system and thinking about some like getting some symptom surveys and stuff. And that would be kind of an interesting little nugget of like even just information to learn about patients to better connect with them.
And support them, right?
Yeah.
Yeah, but the other piece of it that I know there is research on is a trauma background is I
Oh,
find really
absolutely.
common with my chronically ill, any chronic illness, not just allergic
Yes.
diseases.
Yeah. Yeah. And I think what's so hard with our current system is, well, one, from a payment model standpoint, there is a lot of incentive for our system to break our problems or our body down into these super hyper, like specialized areas. So you don't only go to the ear, nose, and throat doctor now, but there's actually a voice box doctor, and there's an ear doctor, and there's a sinus doctor. And that even in such a small specialty, there are these super specialists. And part of it is so that you can get someone in and out of a visit quicker, right? And bill for it. And then, you know, you have mental health services, which are completely separate, oral health and dental health, which is considered totally separate. And none of that makes any sense. And when you have systemic conditions like mast cell disorders, autoimmune disorders like Sjogren's, you need someone to be able to look at that whole picture because they do affect you from head to toe, or they have the potential to. And so that's where I really loved in my current practice having so much more time to ask those questions and to connect those dots because that's what's lacking kind of in most of our current health system setup.
I agree. I think so many people are searching for that. That for anyone is difficult to navigate, but particularly when you have something chronic that you're managing that's affecting your energy, or you're in chronic pain, or you're in a hypervigilant state because you're in danger, or being so careful about diet or meds, then the extra energy to I have to go see 7 different doctors is not, serving the patients. And of course it's a systemic, I don't mean to blame any individual doctors, but our
Yeah.
system is not set up to support people holistically, like you're saying.
And even now, there's a new tool that I am so hoping will take off as a startup. But the whole purpose of the startup is to help with the referral process. But one of the tools they're building as part of this is a way for docs that are working together to communicate with one another about a particular patient in a way that's HIPAA compliant and that's EMR, electronic health record agnostic. Because I may be using one platform and the folks at another health system may be using Epic or what have you, and it's hard to get people on the same page. Where if you do have a cardiologist and a neurologist and the immunologist, and we all have our like strengths and weaknesses, but I might suggest a med that's maybe a bit more of like an in neurology's purview. And I'd love to get there. Like, what do you think about Mestinon? Or, what do you think about this? And like those conversations just aren't happening because there aren't easy ways to do it. There's a lot of friction. And when there's friction and you're in a system that has you pressed for time, overbooked, it doesn't happen.
Right. That is exciting. In the meantime, for patients who are navigating this, what do
Right.
you recommend as someone who's lived it? How can they
Yeah.
make that a little easier?
So, one, when you call to make an appointment with whatever, care team member you're making it with, helpful to ask the front desk or the scheduling person, how long is my appointment scheduled for? And do they double book? Because that's going to give you a rough estimate of how much face time you might have with that clinician. And then I think it's helpful to do a little thought work before that visit. Okay, I'm going to see the neurologist, and this is the neurologist that specializes in movement disorders. What are the top questions that I need this specialist to answer so that I can make the most of that 15-minute visit that I have? Because I'm not going to be able to like bring the binder that's like, 3 inches thick. I think having ideally 1 page, 2 page summary of like the highlights. Here are the diagnoses that I have. Here are the diagnoses that we're very suspicious for, my updated med list, and the other docs on your team. Like, and I know this is hard because not everyone obviously has gone to medical school, but the reality is that if you're living with a chronic illness, oftentimes you've had to get a lot of that education on your own. I've joked that we need like a special degree for folks living with chronic illness and parents of kids with chronic illness. They need like a special like badge they earn.
Designation. Yep.
Yeah. Yeah.
Dr. Light.
But that can be really helpful. And then thinking of some of those questions ahead of time, many of it, like I include myself in this. I go into a stress response when I go see my docs. Even I have the nicest rheumatologist ever. She's like sweet as can be. I shouldn't be stressed. Like consider her a colleague and a bit of a friend. And yet I still find myself doing that fawn response where I'm like trying to oh yeah, everything's been fine. I'm great. Like,
Mhm. We want to be good patients. We
yeah,
want
yeah, which doesn't serve me. So
no.
I have to think about ahead of time. No, no, no. How has my stiffness been? I've been to her several times, so I kind of know the drill, right, for those follow-ups. But those are some, helpful tips. You have to be strategic. And and sometimes there may be folks on your team that frankly their bedside manner leaves a lot to be desired for whatever reason. And there may be some elements of gaslighting and other things. I think it's also helpful to know what are you hoping to get out of that visit and using the system. I don't want to sound, but like sometimes you have to think about your objective and sometimes you have to go with the flow a little bit to get to from point A to point B.
Right, right, and understand the limits and the restrictions of how it's going to work in that system.
Yeah. And like there are some times where you're like, I really want to call out this person because frankly they are being a jerk. But then okay, but reality is I just need this one piece from them and I may not actually have to stick with them. But let's just try to like hold it in and not unload all of that like frustration and just get in, get what I need and get out.
Yeah, so helpful to hear. And I love too that you're touching on this piece about having all of that awareness, but then the self awareness too. Like you said, I tend to fawn. And a lot of people do
Yeah.
get nervous. There's white coat syndrome is a real thing, even from a doctor sitting here telling you
Yes.
herself, we all get nervous. So thank you for emphasizing that.
Yeah. I think the other thing that's really hard, and I see this often, and I understand how and why it happens. Often folks with chronic illness, especially a chronic illness that's hard to diagnose, will play this game of like hot potato from specialist to specialist, right? Trying to find some answers, and they'll go through a whole battery of testing and a lot of box checking or unchecking or normal results. And then often because the typical medical system or insurance-based system doesn't doesn't see them, doesn't hear them, doesn't believe them, or the perception certainly comes across as that, they often will turn down alternative paths. And this is where I also see a lot of potential for harm that comes about there too, where, folks will come in and they're on lists of supplements that are twice as long as any med list they've ever been on, or they've done a whole host of like testing that has no scientific validity. And admittedly, I mean, I try to walk this line because frankly, if a patient is coming to me and they've already gotten that done and they have already kind of established working with that other healthcare person or coach person, like didn't come out with the outcome that they had hoped, they already feel burned. Me calling that out adds to the shame, right? Like I don't like necessarily always call it out as much as maybe it's like the walking this line, right? Of like you want people to understand the science and what may or may not be helpful, but also I don't need to add to the shame cycle that happens too. And like I said, I mean, I went down the path of superfood supplements and other things. Like I've gone astray and come back, and like these that aren't necessarily evidence based medicine, right? But there is such a fine line of between what may be helpful for some, also has potential to be harmful.
Right, which is so complicated. And then, of course, then the emotional complexity comes in that
Yeah,
balance. But I appreciate though that you're saying, to navigate that obviously with doctors you trust, evidence based, and then not to just toss out the like, I don't like the way this person interacts with me, or I don't have a huge amount of trust in this doctor because of their bedside manner. It's like you said, it's kind of your own balancing act to do in terms of building that team and considering all the things that you're throwing into the pot are all important. Thank you for discussing it in such a nuanced way. I think it's really helpful.
yeah. There's a lot of gray.
Mhm.
My
Well,
fingers on.
so in speaking of
Yeah.
so what's great for me that I'm really looking forward to learning more about, you offer a treatment that I did my research. There is evidence to support this, which I would love for you to talk about. But in all of the allergy spaces that I'm in, I don't hear people talking about ILIT. And
Yeah.
so for me, that's a gray area. I don't not gray in terms of I'm not
No,
saying
no,
this is
no, but just like, what the
what
heck is this?
is this? Yeah.
Yeah,
So I really think
different.
my audience would love to hear you talk about what you're doing, how it
Yeah.
works, and why are we not hearing more conversation about it?
Oh, let's spill the tea. So, immunotherapy is a way that we are able to treat allergy. Immunotherapy is a way we're able to desensitize the immune system to better tolerate things we're allergic to. And so, traditionally, that primarily has been for rhinoconjunctivitis, so nose and eye symptoms. So, grass, trees, weeds, molds, dust mites, kitty cats, dogs. In recent years, we've also seen some increased research and availability of oral immunotherapy and some epicutaneous, so some food allergy treatments that are kind of taking shape in a little bit different way. But for typical allergies, asthma, airway allergies, allergy shots actually in immunotherapy originated over 100 years ago. And when they were initially studying the safety and how helpful it was, they also were studying the oral administration of allergens. They were doing kind of like an oral mucosal immunotherapy. There were some studies that would initially look at putting pollen in the conjunctiva, so the lining of the eye. That had quite a bit of side effects, as you can imagine. Red, watery, puffy eyes. People didn't like that. For a while, they looked at administering it intranasally. That made the allergy symptoms temporarily worse. So, again, people didn't like that. But in the US, the mainstay of allergy immunotherapy treatment has been shots. And interestingly, in a lot of areas, like in, for instance, Italy and Japan, other parts of the world, sublingual or under the tongue immunotherapy has been the mainstay of treatment. And I'm not great at remembering statistics, but I believe 80% of immunotherapy at some point in time in Italy was sublingual, so under the tongue. So there are and there have been these other modes of immunotherapy that have been explored and have been found to be effective to varying degrees. In the US system, injections were the primary mode of treatment. I think in large part it was kind of a tradition, but also insurance-based reimbursement has traditionally been really good for immunotherapy. And so if you are a private practice allergist, one of the ways surgeons operate, they take out an appendix, a gallbladder, and that's how they get paid. Allergists, like allergy shots, were their procedure that reimbursed well, and they're effective. And so it was, a good business decision to offer that treatment to patients. Interestingly, in the last 5 years or so, though, that is not necessarily the case. And reimbursement as allergists, like, it's come down a lot. And the cost of extract has gone up considerably. So I suspect that we will continue to see more allergists offer this intra-lymphatic immunotherapy that we're going to talk about next. So I think a lot of it's been driven primarily by money and reimbursement. What we realized between allergy shots and then allergy treatment that went under the tongue, whether it was liquid drops or tablets, was that adherence for both of those is abysmal. It's something like 60%, if that, of patients will actually stick with it. So for sublingual, you have to take the treatment daily, ideally for 3 to 5 years to see lasting benefit. For allergy shots, you're typically going into the office most often weekly as you build up. And once you get to what's called maintenance treatment, often you'll be able to space out towards once a month. But again, you need 3 to 5 years of treatment before you'll see lasting improvement. So when you stop, you continue to have benefit. So that's one of the great things about immunotherapy, is this ongoing benefit after you stop treatment. And that's kind of why the juice was kind of worth the squeeze. Some allergist scientists in Switzerland about, 25 or more years ago, were sitting around and saying, gosh, why aren't we using some of the science that we understand from vaccination with immunotherapy? And what we know about immunotherapy is when you inject allergen under the skin, some special immune system cells called antigen presenting cells or dendritic cells, they will capture a portion of that allergen. They will bring it back to the lymph node. And it's in the lymph node where a bit of speed dating process occurs. And that's where the actual immune system retraining happens. It happens in the lymph node. So Dr. Kundig in Switzerland and his colleagues were like, ooh, what if we deliver a smaller amount of allergen directly to the lymph node? What might happen? What they hypothesized was that they would need fewer treatments. And so they initially studied that in animal models. And what they noticed too was there were less reactions, so less systemic reactions, because in the lymph node, as long as you hit the lymph node, there are fewer allergy cells in the lymph node that create anaphylaxis. And so then they switched over to studying in humans, and sure enough, it worked in humans. So what they found was, and this of course over the last 25 years has been honed and improved upon, is that if you take a small amount of allergen that you're allergic to and you use an ultrasound, direct the needle to the core of the lymph node, you can deliver that on 3 occasions, each 4 weeks apart, and you can see improvement typically by, if you start on day 0, by 16 weeks after that initial treatment. And that even when they looked at patients 19 years out from like that first human cohort that they compared intralymphatic versus regular subcutaneous, they went back, they found 70% of the people who had gone through the initial trial and they said, "Hey, how are you doing?" And equal numbers between the regular immunotherapy and the intralymphatic said, "I'm doing great. Like, I'm still doing awesome. Thank you." Added that last bit. But there seems to be great durability too. And so that is essentially kind of intralymphatic immunotherapy. If you're allergic to dust mite, kitty cat, Timothy grass, you make a customized serum to you with those in it. We use a little point of care ultrasound, which actually can have in my backpack here. It connects to an iPad, and little of the cold gel. We typically will inject in the inguinal area. So that's where the leg meets the body, in part because the lymph nodes are really close. They're just under the surface of the skin. So you don't have to go, real far in. And the pain receptors are not quite as sensitive there. Is it one of the other places you could think about doing is the neck? People get a little more squirrely on your neck. And frankly, in your neck, there are some more structures in that space that are you wouldn't want to hit. So like nerves and blood vessels that you're like, oh, we don't want to bump into you. There's less to bump into down in that area. We typically watch folks for about 30 minutes after their injection, and then they go about the rest of their day, and then they come back a month later, and then 1 month after that.
So let me make sure I understand it correctly. People hear needle and they're just, oh,
Yeah.
you're saying the research is kind of comparing traditional allergy shots, which are really well established, both
Yeah.
involve a needle. However, it sounds like the benefit is that by going directly into the lymph node, we're
Yeah.
bypassing where some of those allergic cells on the way to the lymph node might be
Mhm.
activated. Does that mean there's
Yeah. So it's more efficient too.
okay.
So you can use a little less allergen, and you only have to go 3 times as opposed to going weekly and then monthly for 3 to 5 years. When you look at adherence of someone like sticking through the entire course of treatment, you can imagine it's a heck of a lot easier for someone to get through 3 visits as compared to closer to 100 visits over 3 to 5 years. Interestingly, the out-of-pocket costs, there's been some analyses done. Typically, the out-of-pocket costs are a wash when you look at sublingual injection and intralymphatic. It's just, as you can imagine, intralymphatic, you're doing it over 8 weeks. So all that cost is upfront,
All at once, right?
essentially. But you think about this time and energy and gas savings, all of that. And then it's like, oh, well, the math starts mathing a little more.
How about insurance then? Is that something that's starting to be
So
covered?
it is not covered by insurance at this point in time. The hope is that perhaps at some point, but to be honest, with how insurance marketplace has evolved over the last 5 to 10 years, it's pretty rare to see insurance opt to pay for something that they don't necessarily have to pay for. Like, they're not adding things to what they're paying. They're trying to cut what they're paying for. And what's sad, one of the things I remember distinctly, so Dr. Kundig, he's the father of intralymphatic immunotherapy. He came to Nationwide Children's Hospital to give an academic talk right as I was in the transition point from residency to fellowship. And I wasn't totally burnt out yet, and I wasn't totally cynical yet. Not that I'm, totally cynical, but he's like, one of the reasons this hasn't caught on is there's no financial incentive for anyone to pursue the research in huge ways, especially in the US, because the companies that make the serum, they would sell less serum because you just use less of the allergen. They have no interest in funding that. The ultrasound companies, they sell a whole lot more of those ultrasounds to intensive care docs, cardiologists, vascular surgeons, hospitals. Like, we're not even a blip on their radar. And so really a lot of the research has been centered in Europe, where there are healthcare systems that really are looking for solutions that on a population level are more cost effective. And so they're the ones who've really invested the time, energy, and money in researching this, because especially there's been some more ongoing research in venom immunotherapy. So folks with bee sting allergies in particular, where immunotherapy is life-saving. And so that they've done some cost analyses, especially out of, again, a lot of this has been out of Switzerland, but to say that from their health system, which is government funded, that they save money by doing this option as compared to the traditional in the arm shots. I think what's exciting is there are some whispers, and like I get asked a lot, is this available for foods? It's not available for foods yet, but that is on the radar of folks that are really interested in this, area of immune system research. And so more to come, I think, in the coming years.
Is there any data on that yet? Are they researching it or are they?
Not in humans, not to
Okay.
this point.
Okay.
And part of it, many years ago, there was an immunotherapy trial for peanut allergy that was shot based. And unfortunately, someone in the placebo group received a peanut containing shot and passed away. And so that really shut down any type of peanut immunotherapy for a very long time, understandably so. And so that's why kind of some of these other routes have been researched, just because there are lower rates of, life threatening. Certainly it still is the risk, but it's less so than what they were doing back in I think it was late 90s.
Okay. So could you tell us about that then in your practice and with your clients, what you were seeing as far as the benefits, obviously, and then what the risks, if there are some side effects, or what the chance of reactivity is in your experience?
Yeah, so there still is a risk for systemic reactions. So every patient is bringing, their epinephrine device with them, whether it's the injectors or the nasal spray. And we talk through that risk versus benefit, though it does appear that the risks are lower than what you would have a shot. So shots, we estimate somewhere around 1 in 100 folks will have a systemic reaction. And then an ILIT is thought to maybe be around 1 in 1,000 if you have someone like who's really adept at doing it. And then what's really cool is there are some folks, especially I think those folks who've maybe had immunotherapy a little bit in the past, they sail through it. Occasionally I'll have someone who, they've never tried immunotherapy. And so it's their body's first time of seeing that. And so we'll sometimes see a little bit of swelling, itching at the injection site, kind of for the day or so after their injection. Most folks, they'll feel that little pinch as the needle goes in, and then I have to adjust kind of to make sure the needle's in the exact space and that I want it to be in, and use the ultrasound just to check kind of from both directions that we're in the right spot before we actually push the allergen in. But typically, they say, "Oh, that was it." Like that's often what I'll hear from folks, like, "Oh, I was so nervous over nothing." So that's often what I'll hear after that first injection. And then they usually will come in for that second or third visit, like, "Oh yeah, no big deal. We got this." And then occasionally after that second visit, between the second and third visit, if someone's living with a cat or a dog, or it's the middle of pollen season, and we can sometimes start to say like, "Hey, how have your symptoms been doing?" And occasionally we'll have someone say, "I don't think they've been so bad." But usually it's after that third injection where we are kind of seeing really those symptoms dial down. A couple of my patients, it's timed out where we finished up their treatment kind of right as allergy season's ending. So it may be, next spring before we really see kind of where, the proof is in the pudding. But it's exciting to, see folks say, "Oh gosh, I went over to my cousin's house and they have cats, and like, I didn't die. Like normally my asthma is so bad, and like I did great. I didn't need my inhaler." I have a little cohort of patients that are gentlemen who are getting ready to retire, and they love golfing. And like, they're like, "I have had to show up to the office. I now just want to show up at the golf course. And so those are the other folks that are like so excited about this. I had someone flying out from a DC area to Columbus to get treatment for their allergies for that very reason. So he's all set now for his retirement this spring. So
First
I
things
know.
first.
I know. Yeah.
Important, right?
And then I see a lot of like high school, college age athletes who, are playing soccer, playing baseball, these sports that they love, but are really being impacted by, especially like baseball's right in the middle of grass and tree season, or soccer, which always happens to be in both grass and ragweed season. So, and typically we'll treat folks usually adult size. So, if it's a 12-year-old that's kind of already gone through that big growth spurt, then usually we're, as long as everyone's on board, and usually just making sure the kiddo feels comfortable with, with what we're doing too. Each kiddo is different. I have 3. And like I could say for certain that my 10-year-old's going to react a whole lot different than my 7-year-old with the idea of a needle coming at her.
Yeah, but that's the whole exciting thing. The reason I'm doing this season of the podcast, there are options. We didn't used to have any options, and now there are so many
Yeah,
things. So it is
incredible.
so individualized depending on each
Yeah.
person. But this is not an option for younger kids, right?
My colleague who trained me, I think she said the youngest she had done is 6 or 7. Dr. Amber Patterson is my mentor in this. She is like a world expert and really kind of the go-to person in North America for, we'll call it ILIT immunotherapy or intra-lymphatic immunotherapy. She's a pediatrician by training, and she did the first clinical trial in teenagers with grass allergy and found it to be safe and effective through that trial. But I think in her practice, she'd said 6 or 7 was about in kind of who she's seen, and both from kind of body size, but also just the maturity level of the kiddo too.
Okay, this is so helpful and exciting to hear. Obviously, I want to have you share with everybody how they can find you. But in general, if people are looking for a doctor and maybe you're not an option geographically or whatever it may be, is there a directory?
The AUNI Learning Network, AUNI, has a directory of docs that they've trained. We all come together and bring our data together. Those of us that are part of the network are really committed to being like up to date on the latest training, staying up to date on the latest research. When we had our annual meeting this last year, we brought in virtually the researchers from Switzerland to give us all the updates on what's going on. So that's a really great resource. I know they have folks at Washington University in St. Louis. My colleagues at Ohio State offer it. So it's not just private practices, but academic institutions that are really getting on board too.
Very exciting. And so for people who are loving listening to you talk and your approach, please tell them where they can find you. And obviously
Yeah.
you have your older podcast, you have a newer podcast, is that correct? So
Yeah.
not just if you're interested in the treatment, but I think you have a lot to share with people. So please tell.
Yes. So the home base for everything is my website, drkarawada.com. My practice is the Immune Confident Institute, and we're currently licensed in 16 states, physically located in the Columbus, Ohio area. It's myself, nurse practitioner I've worked with for years, has come on board and hope to be growing our team as well. And we see kids and adults for a whole range of allergic and overlap with autoimmune conditions. On YouTube, it's at Dr. Kara Wada is the channel there. And we have both kind of my solo episodes all located there. But also you'll see linked to a project I have going with 2 of my best allergist girlfriends, Allergy Actually, where we'll have some more allergy specific content, talk a little bit more about ILIT, food allergy treatments, from the perspective of being moms and friends too. And on social, on Instagram, I'm probably most active. It's Immune Confident MD.
Perfect. Well, I will make sure all the links are handy for everyone so that they can find you and learn. We've got a lot of topics thrown in the bucket here that you share about. So I think a lot of people that will really appreciate following you and finding all of the great information you're putting out. Thank you so much for being here on the show.
Thank you. And one other, we should have a freebie up on the website still. It's how to get ready for an appointment if you're meeting with an allergist, immunologist, or you just want a resource to kind of put all that information on one place. It's a PDF, so I don't get any of that information. It's totally just for the patient to use, and to think about things with a little bit of like what the doctor will be thinking about. It's a really great free resource that's over there too.
That sounds wonderful. Thank you. I will make sure I find that and share it for everybody. Well, thank you so much. It's great to meet you, and I really
Yeah,
appreciate you
too.
sharing.
Take care.
You too. Thank you so much to Dr. Wada for joining us, and for all of you for listening. Here are 3 action steps that you can take to follow up on what you learned today. First, follow Dr. Wada, drcarolwada.com, on YouTube at Dr. Carol Wada, on Instagram at immuneconfidentmd. I will put the links in the show notes. There are so many great resources that you won't want to miss that she has created, including her resource on how to get ready for an appointment. Number 2, if you're curious about intra-lymphatic immunotherapy, explore the provider options listed on Ani Allergy's directory to see whether ILIT, ILIT, is available in your region. And their website, which will also be linked in the show notes, is aniallergy.com, AUNI. And third, if you are navigating immunotherapy decisions and feeling the emotional weight of these choices, my workbook, From Fear to Freedom, Navigating Allergy Immunotherapy, walks you through the psychological, relational, practical considerations that often get overlooked. You can find it anywhere you buy your books, but I would encourage you to purchase through bookshop.org, where you will support independent bookstores. Thank you so much for continuing to listen, to support the show, for sharing, liking, leaving ratings and reviews that are helping the show to continue to grow and reach more people who need this support. I'll talk to you again next week. The content of this podcast is for informational and educational purposes only and is not a substitute for professional medical or mental health advice, diagnosis, or treatment. If you have any questions about your own medical experience or mental health needs, please consult a professional. I'm Dr. Amanda Whitehouse. Thanks for joining me. And until we chat again, remember, don't feed fear.